Hey guys, my name is Kat and I am a Women's Center volunteer. I hope that everyone is having a safe quarantine. I hope that you're in a place where you can get some rest and stay healthy and get what you need to do done. And mental health is so important right now. So I hope you're taking care of you above anything else. It's a crazy world. Um, so like I said, my name is Kat. I'm a junior middle grades education major and I'm a volunteer in the Women's Center. So we really wanted to stay in touch and keep providing services, even though classes are not meeting right now. I'm going to be doing a weekly or so women's health presentation on various topics and ideas about women's health. In the community, this has been something that we've been trying to get started as an outreach program for a while. And so via these videos, I will be giving you some insight and some information. I am by no means a doctor or a medical professional. I am just very passionate about women's health and sexual wellness. I do lots of research. Everything I'm presenting to you is backed by medical research, obviously, but I cannot claim to be a medical professional. So take what you will, I guess. I hope this is helpful for you guys. And tonight we are going to be talking about contraception, which is a big part of women's health. So let's get started. I have this presentation made that we're going to go through together. So maybe not. Oh. Okay. Contraception 101. So birth control is a big topic of contraception and women's health. And basically that means any method that is used by a sexually active individual to prevent pregnancy. This is often paired with women's health discussions, as most birth control or contraceptive methods are targeted towards people with vaginas or people with uteruses. And most of them are to be used by those individuals. But really, it's a topic that should be considered by everyone. All sexual partners should be involved in these conversations. So an important thing to consider is contraception, birth control can be used for a wide variety of reasons. The primary function is preventing pregnancy, but various methods can be used for preventing risks of STIs, controlling periods, regulating hormones, all kinds of reasons that someone, based on their own medical needs, may want to use contraceptives. Obviously, tonight I'll be focusing mostly on their use as birth control, but keep it open mind. There are so many options. A lot of people think of just like being on birth control pills or whatever when they think of contraception, but in today's time, there are so many options for any person who wants to dictate their reproductive health. So that's important to consider. And everyone's body is different. What works for your friends. They may have tried a form of birth control and loved it, and it may suck for you, or vice versa. So know that your own body and your own needs and medical history is going to dictate what works best for you. And everyone has a different reaction and a different response to birth control methods. So that's something that's always really important to consider. Informed consent is key when choosing a birth control method. You should always be aware of what's going in your body, what it's designed to do, what it contains, the side effects, the possible risks, the effectiveness. So establishing a relationship with your health provider, that you are informed of everything you need to know when it comes to your reproductive health, and there's no pressures on you to choose a certain method or anything like that, is really important to keep in mind when considering what's best for you. Like I said before, I'm not a gynecologist. I am just very passionate about women's health, and I have done a lot of research, but by no means should what I say what I tell you, override what a medical professional says. So listen to your doctors. So let's get started. So the main types of birth control that are out there are hormonal methods, barrier methods, intrauterine conception, and intrauterine contraception. That's hard to say. And emergency contraception. So those are just kind of the four main categories of birth control we're going to talk about tonight, or I'm going to talk about. So starting off, hormonal methods, kind of what does that mean? So hormonal methods of birth control are methods that work with your endocrine system in your body, basically meaning they affect your levels of certain hormones by usually inducing or adding estrogen or progestin, which are both naturally occurring in your body. So basically, hormonal methods alter your levels of hormones, which will either delay or stop ovulation, so you won't release an egg, meaning there will be no egg to fertilize, or they might thicken cervical mucus, which can also help with contraception. So that's kind of how those work. So we're just going to go through some methods. So the first one is the implant. That's the picture you can see on the slide here. It's a single thin rod inserted in the upper arm that releases progestin into the body. So it's, put in right here, and it releases progestin into your body. Some pros of this method: it lasts 3 years, which is, fairly standard for some hormonal methods, but, it's not something that requires regular attention. It's considered highly effective. It is reversible. You can get it taken out at any time. It's low maintenance. You don't have to, check on it or anything like that. If your body doesn't respond well to estrogen, so if you, have some kind of medical need where you don't respond well to estrogen, this could be a good option for you. And it has been known to reduce heavy or painful periods. So for some people struggling with that, this can be helpful. Some cons: it can cause weight gain, as a lot of hormonal methods can. Weight gain, breast pain, abdominal pain, things like that are fairly common side effects of any hormonal method of birth control. It requires an insertion procedure, which is minimally invasive. It has to be inserted into your body, which, requires seeing a healthcare provider and having that procedure done. It can cause change in bleeding patterns, and it does not protect against STIs. Its effectiveness is 99.99%, which is about as close as you can get with a lot of birth control methods. So that's one highly effective hormonal method. Another is the injection or the shot. The most common is depot. So this is an injection of progestin, estrogen, or a combination of the two, these fertility hormones, into the upper arm or buttocks by a doctor. So it's a shot that you get that provides your hormonal birth control. It's usually done once a month or once every 3 months, depending on which brand and which kind you go with. So some pros for that: it doesn't require daily or weekly attention. It's not, you only have to really check up on it however often you need to by your doctor. It's pretty long lasting, so you can be on this for a while. It can reduce heavy periods, so that's good if that's something you struggle with personally. Some cons of it: you have to keep track of when you get your shot, because you have to get them however often. It requires frequent doctor visits, and along with some other hormonal methods, can cause headaches, weight gain, and abdominal discomfort. It's also not recommended for those with bone issues. So if that's something you struggle with, this might not be an option for you. It does not protect against STIs and is considered 96% effective. So next up is a really popular one, especially for people's first experience on contraception, is contraceptive pills. So they can be progestin and estrogen, or progestin only. So there's different options there, depending on what hormone works best with your body and is recommended by your doctor. Generally taken at the same time every day, and different pills have different cycles. So some last for, you have to get 3 months at a time, and you'll get your period once every 3 months. Some it's a month at a time. It just really depends on what kind you're using. There are tons of options. There are so many different brands and combinations, and there's really just so many options, and you could easily find one that may work for you. Some pros: they're easy to use. It's just as simple as taking a pill. It's easily reversible. So if you decide that you do want to get pregnant, you can just stop taking your pill. It's usually considered inexpensive comparatively to other birth control methods, and almost all insurance providers, if you have health insurance, will cover birth control pills. So it's easier to get, a little bit easier to access. It can regulate your periods or control PMS symptoms. That's has been proven effective for some people, and can have a positive effect on acne. So if that's something you're looking into, that's an option for you. Some cons: it's easy to forget. You have to take your pill around the same time every day. Depending on which pill you're on, it's a little more important that you take it at the same time. But so if you are not a person who is good at remembering to do something at the same time every day, it's not recommended. That's why I'm not on it anymore. And going off of that, if it's not taken effectively, or not taken correctly, not taken regularly, it can become ineffective. It does have interactions with other medications or environmental factors. So like some other medicines you may be on may make it less effective, or vice versa. You have to keep track of when it's taken. And if you have like blood pressure, blood clotting issues, that it can cause an interaction with that and a higher risk for you. They're not super common, but it is something to look out for if that's something I have a medical history with. It can cause weight gain, breast tenderness, and mood swings, and nausea. So that's, again, with altering your hormonal levels in your body, a lot of those side effects are fairly common. It does not prevent against STIs, and it is with typical use, so like not perfect use, but typical use, how the average person takes it, it's 93% effective. So the contraceptive patch is another option a lot of people use. Is a little more uncommon. You don't really hear about this one as much anymore, but it is definitely still an option. So it's a patch that's stuck directly to your skin that releases estrogen and progestin to regulate your hormone levels. It can be worn on your abdomen, on your lower back, on your butt, on your arm. There's a couple different options on where you can wear it. Some pros: it's very easy to put on and remove. You can definitely do it yourself. It doesn't require daily attention. It can stay for a while, and it's non-invasive. There's no like medical procedure or anything. You just stick it on there. Going back, sorry. It is changed once a week for 3 weeks, and then the 4th week, no patch is worn, and you get your period. So kind of similar to a birth control pill, where you're having an active dose for 3 weeks, and then your 4th week is when you get your period. Some cons: it can fall off. That is something that can happen. It's visible, and it requires weekly tracking. You have to be able to keep up with when you change it, when you wear it, when you don't wear it. And it can have some of those other hormonal side effects that we've talked about with other methods, like headaches, weight gain, and mood swings. It can disrupt your menstrual cycle for the better or for worse. It can change your pattern of your period. And again, if you have blood clotting, blood pressure issues, it can cause interactions with that. So it does not protect against STIs, and like the pill, it is 93% effective with typical use. So the vaginal contraceptive ring, NuvaRing, is really like one that's pretty visible out in the media in the world, which you may have heard of before. It's a clear, flexible, elastic band that is inserted into the vagina and releases progestin and estrogen. So you wear it inside of your body. It stays in place for 3 weeks, and then it's removed for 1 week, which is when you get your period, and then replaced. So it's kind of similar to the patch like that. Some pros: you can definitely put it in yourself. It doesn't require removal during sex, which is something that I learned. You can keep it in all the time during the 3 weeks that you're wearing it. It doesn't require daily attention. Some cons is you have to, again, keep track of how long it's been since you've been wearing it, things like that. Some people can have irritation with it, but that just really depends on your body. It can cause some of those other hormonal side effects like weight gain, headaches, mood swings, and it can alter your menstrual cycle. It does not protect against STIs, once again, and it's also about 93% effective. So next up is barrier methods, which is something that's pretty popular and pretty known and accessible. So basically this is anything that physically keeps a sperm from reaching an egg. So any kind of physical barrier that keeps pregnancy from occurring. So the most common is the male condom. It's placed over the penis to prevent sperm from entering the vagina. Pretty self-explanatory on that. It comes in all shapes, sizes, materials. There are, again, lots of options for that. A lot of medical research says it's best used with another method of birth control. So like a condom and a pill, or a condom and the patch, or the ring, or whatever you are using, just to, stay safe. Some of the pros of it are it's easy to access. You can get it in any drugstore, gas station, Walmart, Target, anything like that. Very easy to access. It's inexpensive comparatively to a lot of other things. You can keep it on you and carry it with you. It doesn't affect other medications, and there are really no side effects unless you have like an allergy, which in that case, there are other options you can consider. So some cons: it can easily tear or malfunction. It's a physical object, so there is always that room for error. Like I said, you can have some kind of allergic reaction to it based on your own body, and it can be affected by environmental factors. For example, like if you leave it in a hot car for a really long time, it becomes less effective. So how you store it and how you keep it can contribute to its effectiveness. Barrier methods do protect, well, not all barrier methods, but this barrier method in particular does protect against STI. So that's kind of its main selling point and why you would often use it with another form of birth control. So it does have an 87% effectiveness against preventing pregnancy, which, seems a little lower than some of our other options, which is why it's recommended to be used with something else. But it does protect against STIs. So that's important. Female condom, similar concept, just worn a little differently. It is worn, a person with a vagina will wear this inside of the body, and it keeps sperm from entering the body. So you wear it inside of you, and it keeps sperm from physically reaching an egg. It's inserted before sex, so you just put it in before you're having sex, and it's held in place by an elastic ring at the bottom. Some pros, it's relatively easy to access. They're definitely not as common as male condoms. Like, you're not as likely to find it in a store or something like that. But like, again, you don't need to have a prescription or see a doctor to access this. So it's relatively, easy to access and inexpensive, can be carried with you, and it doesn't affect other medications or side effects. Similar pros and cons to the male condom. Cons, again, it can tear if not effectively used. There's been a lot of research and commentary that this definitely takes practice. So, it might not be something you get on the first try. It takes some trial and error and can lead to irritation. It, again, does protect against STIs, so that's really important to consider, and is 79% effective. Another barrier method is what's called a diaphragm, also called a cervical cap sometimes. So it's also placed inside of the vagina, and it physically covers your cervix to block sperm from entering. It's shaped kind of like a shallow cup, and it often is used with spermicide or spermicidal lube or gel as well. So there's like a spermicidal liquid, something that keeps sperm out of your body, that is used with it as well. Some pros, it's easy to take in and out. Easy to access, easy to use, can be taken with you, isn't affected by other medications, and it's hormone free. So if, like the other barrier methods were as well, but if you are a person that can't really tolerate hormonal birth control, or due to personal reasons don't want to, this is something you could use. Some cons, it can take practice to get it inserted. It can only be left in for 24 hours. So, if you're having regular sex and using this as your primary method, you might go through a lot of them. It must be initially fitted by a doctor, and it can cause some irritation. So this is a little more high maintenance than like a condom, but still a good option for someone who's interested in a barrier method. These do not prevent against STIs like other barrier methods, because they are only blocking your cervix. So you're still having contact between a penis and a vagina, or any other object in a vagina. So they do not protect against STIs. And they are 83% effective in terms of preventing pregnancy. So the next category is intrauterine methods, something that's become a lot more popular recently, and my personal favorite. So it is some sort of device that's inserted directly into your uterus, that prevents pregnancy one of a couple different ways, as we'll talk about. So it's something, usually a plastic or copper T-shaped object that is placed directly into the uterus to prevent pregnancy that way. So this first one is an intrauterine system that is a hormonal method. So you'll hear about like a hormonal IUD. IUD, IUS, they kind of mean the same thing. It's an intrauterine device or system. This is just technically called an intrauterine system. So like Mirena, Kyleena, Skylo, Ileta, all of those are considered hormonal intrauterine systems. So it's a T-shaped device made out of plastic that is placed in the uterus that releases small amounts of progestin to stop ovulation and thicken cervical mucus. So it releases hormones directly into the uterus. It can stay in, depending on the brand you get, and the one you get, from 3 to 7 years. There's like FDA testing being done to see if that can possibly be extended longer. So it really just depends on which one you get, because like I said, there's a lot of different options. They come in different sizes also. So like if one of the specific hormonal IUDs doesn't fit in your uterus well or doesn't work for you, there are other brands that are all the same concept and work the same way, but slightly different in shape or size or things like that. So some pros, they're considered extremely effective. You can't mess it up really. Once it's in, and like you don't have to remember to do anything with it or, things like that. It's just kind of set it and forget it. Like I'm going to talk about in a minute. It's very low maintenance. Again, you don't have to check up on it regularly. Some doctors, not all, recommend checking the strings. So there's strings that hang out of the bottom of it for when you need to remove it. So some doctors for the first couple months recommend checking them, just make sure it's like hasn't moved around or anything, but that's very uncommon. It's long acting. Like I said, 3 to 7 years, depending on the device that you use. It is reversible also, like, you can take it out and try to get pregnant if that's something you are interested in. It isn't affected by other medications or environmental factors for the most part because it is localized in the uterus. And so there's also less chance of side effects because the hormones stay in your uterus. They're not entering into the rest of your body and your bloodstream, like maybe with a pill or something like that. So there's it's not the case for everyone. People definitely do still have side effects with it. Some of those other hormonal side effects, like we talked about earlier, because it is a hormonal method, headaches, weight gain, breast pain, things like that. But it's less likely with an intrauterine system than with some of the other hormonal methods. It has been known to regulate period. Many, not all, women stop getting their period altogether with the IUD for a little while or while it's in. And if you don't stop getting it altogether, it's likely that it will become more regular. So that's a nice benefit for a lot of people. Some cons, so it must be inserted by a doctor, and which can be painful. People have definitely reported pain with insertion and the procedure being uncomfortable. So it's kind of a slightly invasive procedure to get that inserted. And there's like tenderness and bleeding possible after insertion. And there is a very low risk of expulsion in the beginning, which again, going along with that informed consent, knowing that this is a possibility that your body can expel it and it can move, which can cause perforation, which can be really dangerous if not treated early. But that, again, that's a very low risk and something you can consider with your doctor. It does not prevent against STIs and is considered 99.9% effective, which is pretty high. So the copper IUD is very similar in theory. However, it is a non-hormonal option. It is a T-shaped device that contains copper threads or cylinders, which release copper ions. So it releases copper particles, which immobilize sperm and keep them from reaching eggs. So it keeps sperm from reaching eggs, essentially, to prevent pregnancy. So some pros of this is it is non-hormonal and long-lasting. So the copper IUD in some cases has been known to last up to 10 years. So it's really a long-lasting option if that's something you're looking for. It's non-hormonal again, so if you have other medical issues or personal preferences that don't align with hormonal birth control, then this would be definitely an option you could consider. Again, it's reversible. You get taken out and try to get pregnant if that's what you decide. It doesn't affect other medications, so you don't have a risk of it interfering with any other meds you may be on. And it can be used as emergency contraception, which we will touch on a little bit later. So that's another pro. A con is in some people, it has been known to cause intensified cramps or heavy or irregular bleeding with periods. So it can make your period symptoms a little bit worse in some people. There's this, again, a small risk of expulsion as with the hormonal IUD, and it must be placed by a doctor again. So very similar to the hormonal IUD, just works non-hormonal and releases copper ions. So it's considered about 99.2% effective. And then again, it does not protect against STIs. So emergency contraception is what you hear about, the morning after pill, Plan B, that kind of deal. So it's for when there was no form of contraception used during a sexual encounter and you're after the fact trying to prevent pregnancy. So it is basically a morning after Plan B. There was no regular contraception used, and it's a the next day or as soon as possible kind of thing after unprotected sex has happened is the key there. So there are really two forms of emergency contraception. So emergency contraceptive pills, Plan B, morning after pill, that's what that is. They work similarly to an oral contraceptive. like a birth control pill. It's just a much higher and more concentrated dose that you take all at once. So it will delay your ovaries from releasing an egg that will meet sperm. So that's kind of how that works. And it can be taken up to 72 hours after unprotected sex. The sooner is the better. The longer you wait, your chances of it working will go down. So it basically, after the fact, tries to stop the egg from getting to the sperm, or the sperm from getting to the egg, either way. So it delays that release of an egg. And then the copper IUD, which we looked at here, can also be used as emergency contraceptive, again, within the first 72 hours if it is placed. It can work as emergency contraception. So just some things to know about emergency contraception. Emergency contraceptive pills have been shown not to work the same with people over a certain body weight or over a certain BMI. So that is something to consider, just the effectiveness of how it will work with your individual body. And other things such as your menstrual cycle or other meds you're on can, just as with contraceptive pill, interact with this. So that is something to consider. And with the copper IUD, again, it has to be placed very soon. So you'd have to get in touch with a medical provider very soon after unprotected sex. So if using emergency contraception in a situation where that is required, the sooner the better. You need to act pretty quickly on that. So I think that brings us to the end of my presentation. If you have any questions or topics that you would like addressed in next week's video, please reach out to the App State Women's Center. Follow us on Instagram, on Twitter, on Snapchat, on Facebook. You can send us an email. We are super accessible and want to help you guys during this crazy time. So yeah, thank you for listening along, and I really appreciate it, and I will see you soon.